My name is Dr. Paul Denker. I'm a board-certified endocrinologist, and I'm also board-certified in internal medicine. I currently work with Baker Medical Group and Morton Plan Hospital. So one of the major problems we have today in the hospital settings are pathogens that cause healthcare-acquired infections. We continue to have worsening problems with hospital and healthcare-acquired infections due to the resistance generated by the use of antibiotics. These superbugs are very difficult to kill. The old disinfectants, which are usually phenol-based, don't permanently kill these bacteria. And in fact, hours after disinfecting with phenol-type disinfectants, the number of bacteria are back to the same level they were prior to that. Today, there is a new technology that's available that may offer a much better outcome than previous disinfectants. You know, the possible sources of these new bacterial infections are not only the patients, their nasopharynges, but now we're seeing that things like the floors in the hospital are potentially areas where these infections can come up. And in fact, patients walking into the hospital on their soles of their shoes carrying all of these resistant bugs. Out of Arizona, there was a study that said the average shoe carries almost 500,000 bacteria per square inch on them when they come into the hospital. So there's a lot of reasons why these infections continue to spread and why we need new technologies to stop it. So the University of South Florida field study discovered that over 3/4 of people coming into the hospital have pathogens on the soles of their shoes. C. diff, VRE, E. coli, Candida, and especially MRSA, methicillin-resistant Staph aureus. The USF study used a new technology called PathO3Gen Solutions, which is an FSD, or a footwear sanitizing device. It is a device that kills the bacteria on the soles of the shoes in 4 to 8 seconds of exposure using a combination of ozone and UVC therapy. So the results of the USF study were quite remarkable. It was found that over 99% of MRSA was killed by this new therapy, and that over 97% of C. diff was killed in seconds by this therapy. And we know that UVC kills pathogens, but the key to this new technology is that it ruptures the capsule of the bacteria, thereby degrading the DNA and preventing recurrence of the infection. Unlike previous disinfectants which contain phenols, these agents do not come back and do not recur. There was also a recent study from the Association of Professionals for Infection Control that showed, like the US study proves, 77% of patients coming into a room are tracking in these pathogens. These pathogens then populate the floor, they then become airborne, they're inhaled by the patients, they reach high-touch areas such as trays and furniture, and then they pose a very large threat to our inpatients and our outpatients as well. Given the current environment and the hospital situation with these new superbugs, I think any and all technologies must be employed to reduce the infection rate in our hospitals. FSD, with its use of ozone and UVC, is a new major breakthrough that should significantly improve our hospital outcomes through the elimination of these pathogens. We are looking at a dilemma where 2 million patients a year are being infected. The cost is in the billions of dollars. Any technology that can help reduce health-associated infections in the hospital should be considered by any and all hospital systems. Financially, it makes sense, and for the health and welfare of our patients, it definitely makes sense.